Today, case numbers for today. North Dakota Department of Health confirmed 23 additional cases today of the COVID-19 out of 431 tests. I want to point out a couple things about this. First of all, we think about net because we had 23 new positives, but we also had 6 recoveries today. So from a net standpoint, this 23 that you're looking at right now in this slide is there's 17 net. That's our third biggest day of net increases. So again, one of the things we're watching for is when might things start climbing up on the curve in North Dakota, but this is our third biggest day. 16 of those 23 cases were under the age of 40, and 2 of them were between ages 10 and 19. So again, while there may be a belief that this is something that is a serious, which it is, deadly for people that are elderly or have and especially elderly and have underlying health conditions. But even if you're a teenager, you can get it, and it may not be fun because I'm assuming if you're between 10 and 19 and you went in and got tested, it was because you had symptoms and someone was worried about you. So again, just want to make sure this touches everyone and everyone, regardless of your age. If you have it, you can be someone who spreads it to others. And while it may not be fatal to you, it could be to someone else. Sadly, yesterday we had, over the weekend, a man in his 50s from Ward County passed away from COVID-19. He had underlying health conditions and he acquired COVID-19 through community spread. And then just before this conference, not reflected in the data that we have here, but we did learn that a man in his 80s from Morton County with COVID also died overnight. He had underlying health conditions, was in close contact to someone who had tested positive. His passing is not reflected in today's report, but it will be in tomorrow's. So at least right now, we can expect that tomorrow the total number of individuals who passed will be 9. I want to go back to that first slide. When we had 23 positives and 431 tests, that's a 5.3% average. That's one of our higher days in terms of positive tests per the tests taken. Of course, it was a little bit lower on the test numbers, as is expected. I think we always are going to see lower test numbers on weekends, and maybe especially you might see tomorrow lower test numbers reflected in very few tests being taken on Easter Sunday. So this 5.3 in terms of percent tests that were positive is higher than our run rate of 3.1, but I also want to mention that before, when we've been below 3.1 like we were a week ago, we were doing what was called the surveillance testing, where we had gone to Slope County, Amadon, North Dakota specifically, but tested people from that region, and Gladstone, where we were testing people around the Gladstone, East of Dickinson area. In both those cases, there was no criteria. You could come up, drive through, get tested. So there was a lot of people that were asymptomatic. That was part of what we're trying to find out, is people without symptoms, were they positive or not? We did find out that in the case of those 2 tests last weekend, that of the 6 positives that came from those 2 tests, half of those people, 3 of them, had no symptoms whatsoever. So we know that you can be a carrier of this and not have symptoms. So that was good learning for us and good learning for the nation in terms of rural health. But this past weekend, on Saturday, we'll talk about a little bit more, we did some targeted testing where we went up to Montreal County, and in collaboration there with MHA Tribe, part of the testing that occurred, and some of those are reflected in this numbers, is people we had identified through contact tracing that had been exposed to someone was positive, we invited those individuals to come in and get tested. And so it's natural that when we've got versus surveillance, when it's just, hey, whoever you are, come and get tested, versus by invitation only, we know you've had contact, we're going to have a higher percentage. And that's why we saw this number jump up today in the thing, but it's to 5.3. But again, we're still moving above and below 1.5 to 5.3, above and below that 3%. That 3.1% rolling average is still the second lowest in the nation. Only Hawaii is lower than that. So again, on the next slide, again, when we net out our recoveries from our positives, we're nearing that 200 active cases that are confirmed. As we've said before, there are likely much more of spread than this in North Dakota than what the number of active cases. But a key number that we want to focus on here is number of hospitalizations, and that number is 13. And again, that would represent across our 55 hospitals less than 1% of the total beds in North Dakota, by a lot less, maybe percent. So that's the status on that. When we go to the actual curve, which we've shared with you before, again on this slide, above the line is the active tests netted out against the recoveries on the bottom, the recoveries in people who've passed away on the bottom. And again, you can see when you look at this, this is our third biggest day in terms of a net increase of a net of 17 from yesterday to today. We're going to take a look again at positive rates by counties. We've got some new leaders here. This can jump around a little bit in some of these western counties where I think Montreal had our highest percentage of testing going into the weekend. But with all the testing we accomplished in Montreal, we found more positives there, but with more testing, the percent of positives went down. Burke County jumped into the lead, but again, when we've got small numbers, these can move around because that would reflect 2 positives out of 22 tests to get you that 9.1% for the math majors in the room. But again, we are doing testing across the state, and again, people should focus on positives per capita to take a look at where the hotspots are, not on just the number of cases, because we're always going to have a higher number of cases in our areas of higher population, but that doesn't mean we have more per capita or more per person there. Okay.